Today we're going to talk about a subluxation. Subluxation is the most common condition that chiropractors look for when you come into an office. Like when a dentist, the most common thing they look for are what are called cavities, right? Everybody knows what a cavity is. That's, the degeneration of a tooth, how the health of the tooth is. So in chiropractic, it's the health of the spine. Now, why I think chiropractic and the subluxation is much more important, because you can always get a tooth replaced, you can get it drilled out, filled in, but your spine you really can't. Your spine is what protects the nervous system, which controls and coordinates everything in your body. So before we really get into what a subluxation is, I want to go into a little bit of anatomy. And so I'm going to take this model, and this model is of two lumbar vertebrae, and I just kind of want to show you exactly what we're going to look at. So when we look at it from the side, what we're looking at is the vertebral body, the one above. This is a disc, and then on the side, these yellow things are nerves. So these are what are called nerve roots. This is what is called the spinal cord, and the spinal cord comes actually from the brain down the whole spine, and you can see on this picture where it connects to the lungs, the heart, the liver, the stomach, all the way down to your digestion and your reproductive organs. So the nervous system controls and coordinates everything in your body, from your immune system to all these organs, your muscle, how you feel things on your skin, all of those things. And so a healthy spine is very important. And so what a subluxation is, when we look at this, a subluxation, again, where the nerve comes out is formed, and I'm going to kind of take this model apart, is by this half of this vertebra and then this half of this vertebra. And you can see a hole that comes out of here. Well, the nerve comes out from there. And so when a bone misaligns, what do you think is going to happen to that nerve? Is it going to function or express its full potential or less than its full potential? Most probably it's going to decrease in performance, right? So it's not going to get the message from the brain out to the organs or out to the muscles or anything of that nature. It's not performing at 100%. So chiropractically, what we want to do is to make sure the body is expressing at its full potential. When we look at this, what we're looking for is performance. Most people come into this office for pain. It hurts. Well, again, back to this model, these nerves are what are called nerve roots. When they come out of the spine, they come out, and there's three portions to it: sensory, motor, autonomic. Motor is what runs the muscles. If that part is pinched, there's no pain, because the job of that fiber is to move muscles. The second one is the autonomic nervous system, and this is what we're talking about all up here. If that part of the nerve is pinched, there's no pain. There's just dysfunction to these. And then the third, sensory portion. If that part is pinched, you will have pain, but you have to compress the nerve 40% before you feel pain. So the question I ask patients is, if you're not feeling pain, can you still have a subluxation, and is your performance still being reduced? And the answer is, of course it is. So we make sure that we want to check the spine for subluxations, not just pain areas, but subluxations. When you do have a subluxation, it's going to interfere with this transmission. One of the ways we look for subluxations is through an exam, through palpation, but also through x-rays. And I'm going to show you three different x-rays. I'm going to show you a normal one from someone that's 17 years old, and then someone that's 46 years old. They're going to be a little bit different. So when we look at an x-ray, before we get into it, we should have these curves. If you look at this model, it has a nice, what is called lordotic curve in the cervical spine, kyphotic curve in the thoracic spine, and then back to another lordotic curve. Ideally in nature, you're going to see a 43-degree curve this way, 43 this way, and 43 that way. And then we kind of base everything on that. Okay, so now this is what is called a normal cervical vertebrae. And just like the picture we had earlier, you see it has a nice 43-degree curve. The other thing you'll see on an x-ray is you don't see the discs. What you see is just the space where the discs are. And so This is the vertebral body. So this is a lumbar, so it's a little bit different shape, but you get the same idea. This is the vertebral body. These are what are called the spinous process as you see it, but you can see how it stacks up really, really nicely. And what you look for is all the weight is on the posterior portion. The other thing you notice when you look at a full spine, it looks like a big spring, right? So it's going to distribute the weight evenly and not put any pressure where it doesn't belong. And also all the weight is back here, so you don't have any pressure on the anterior portion of the vertebra versus the posterior portion. If you see that, you're going to notice a little bit of a difference. And you're going to see where the very top bone is a little flat, it doesn't have an angle, but you're also going to see up in this area where it's very, very straight. And then what you'll notice is this is putting pressure on the anterior portion. And if you look, there's no degeneration up here, and you're starting to get a little bit of the spurring. So on this model that we were talking about, this is normal, no degeneration. The very first thing you start seeing is the disc starting to thin, and then you get spurs, and then you get actually fusion. Now, this doesn't mean how old you are, because some people will ask, well, is this normal for my age? Well, we have 90-year-old patients that have beautiful spines. But where there's areas of subluxation and those bones are out of alignment, you start getting degenerative changes. This person is 17. And what's happening now with kids, everything is looking down at their phone, they're looking down at their keyboard, they're not looking up. And so what happens, if you're in this position, I'm going to turn around, same way. If you're in this position for most of the day, either at your desk, on a laptop, at your phone, you're actually retraining the neck to be in this position. And what happens again, when it comes up to normal, this person is looking straight ahead, but they have retrained their neck. Just like when a dentist put braces on kids' teeth, they're changing the relationship of the tooth in the jaw. You've now changed the relationship of the vertebra, how it normally aligns. And you can see a huge difference, right? Down at the bottom, not too much, but up top, big, big difference, right? And it's already starting to degenerate. And so you look at this bone, is as old as this bone, no degeneration, and this has degenerative changes, right? So let's go to the last one, and this gentleman is in his 40s. And then you look at this. Now, it's reversed, but look at the amount of degenerative change. You see all these spurs? These are almost connecting. Once these connect, then it's fused, and then you can't do anything about it. They're not moving anywhere. But the thing about all of this, why this is so important, the normal transmission of the nervous system, which controls and coordinates everything in your body, has now been interrupted here. And if this fuses, this is what they're going to get the rest of their life. It will not change. And the nerves that come out of these holes are going to be compressed the rest of their lives. So performance-wise, this person is no way can they perform as well as this person. And again, it doesn't have anything to do with age, because the nerve is going to perform great here and it's going to be diminished here. So what we do chiropractically is we want to get you as close to this as we can. And so we encourage everybody to come in and get checked if they hurt or they don't check, because if we can catch this early enough, it will never get to this point, and we'll never be able to get rid of the degenerative change. But because it's progressive in nature, if you don't correct this, then the body is going to continue to go down that path. Our office specializes in restoration of the curves, in the cervical curve and in the lumbar curve. But I really do encourage you to come in, get checked, and let's see if we can help you.